children almost invariably need some kind of cognitive testing. It's very important. 75% of children with autism proper have mental retardation, for example. Up to 40% in clinical populations can have seizure disorders, so it's important to have a neurologic examination by and large. It's important to have a very good physical examination because these children often have other physical problems, for example, gastrointestinal discomfort for various reasons. They need good hearing and visual acuity checks. If they have earaches, for example, children who are nonverbal have difficulty explaining to others that they have ear pain, so they need a very good physical exam. So it's really a multidisciplinary, integrated clinical examination from an expert team of people who are working closely together. Failure to have any single component of that is unfortunate for individual children. So some steps that parents can take to help their child who has autism would include making sure that the child receives the very best diagnostic evaluation and ongoing care, which really includes monitoring the child through time and ensuring that the child receives adequate services that are indicated within the community. That's often a challenge for families who live in large metropolitan areas. It can be even for them, it can be very difficult to find coherent teams of people with all the requisite expertise for that initial evaluation, let alone linking the treatment recommendations with the appropriate service providers in the community, and then finally finding ways to pay for those services. These are enormous challenges. And the right, good treatment team can help parents navigate that very complex social network. And becoming strong advocates and vocal advocates is in the interest of their child is also something that parents can and should do. And hopefully treatment teams can help parents feel empowered and to know where to go and how to voice their concerns and needs. I think trying to gain reasonable expectations for what the future may hold for their child is also important. Retaining the appropriate balance of hope for improvement and the best possible outcome with realistic acceptance of limitations that they have and shortcomings in terms of achieving the outcomes that all parents most want for their child. That's a very difficult balance to achieve for any parent with a child who has any kind of psychiatric disorder, but especially for autistic children, because they can be so profoundly impaired. And often many of these children can look and can be in their own ways so charming and attractive, and to feel, well, somehow if we can just unlock my real child and my fantasized child from the child who they really have. So having that more realistic perception of what's possible, I think, is really helpful ultimately in retaining the best possible relationship with a child who has autism.